The new astrovirus is causing alarm after it was detected in wastewater. Here are 20 scary facts about the astrovirus infection that you need to know. Welcome back to our channel. Did you know that there are some viruses that are so dangerous that even the government doesn't want you to know about them? Well, today we're going to tell you about one of these viruses, which has recently been discovered in wastewater and has caused alarm. The virus is called astrovirus, and it can cause some serious health problems. In this video, we will share 20 things you didn't know about this virus. So without further ado, let's get started. Number 20. What is astrovirus? Astrovirus is a type of virus that can cause respiratory infections, gastroenteritis, and other illnesses. It is a single-stranded RNA virus, and it belongs to the Astroviridae family. The virus gets its name from its star-shaped appearance under an electron microscope. Number 19. Where did it come from? The first known outbreak of astrovirus infection occurred in 1979 in Chile. Since then, the virus has been found all over the world. In recent years, astrovirus has emerged as a significant cause of acute gastroenteritis in children in developing countries. Number 18. How does it spread? Astrovirus can be spread through a variety of routes, including through direct contact with an infected person, through contact with contaminated surfaces or objects, and through the air via respiratory droplets. It can also be transmitted through contaminated food and water. Once inside the body, the virus can replicate in the gastrointestinal tract and respiratory tract. Symptoms can include diarrhea, vomiting, fever, cough, and sore throat. Number 17. What are the symptoms of astrovirus infection? Astrovirus infection can cause a wide range of symptoms, from mild to severe. Some people may experience no symptoms at all, while others may develop respiratory or gastrointestinal illness. Symptoms of respiratory illness can include fever, cough, sore throat, and difficulty breathing. Symptoms of gastrointestinal illness can include nausea, vomiting, diarrhea, and abdominal pain. In severe cases, astrovirus infection can lead to dehydration, electrolyte imbalances, and even death. Number 16. Who is at risk for astrovirus infection? Anyone can get astrovirus infection, but it is most common in young children and people with weakened immune systems. Young children are more susceptible to astrovirus infection because they have not had the opportunity to develop immunity to the virus. People with weakened immune systems are also at increased risk because their bodies cannot fight off the virus as effectively as healthy people. Number 15. How many people are infected with astrovirus each year? It is estimated that astroviruses cause millions of infections each year, mostly in children in developing countries. However, the true burden of disease caused by astrovirus is unknown due to the lack of specific and sensitive diagnostic tests. Many cases go undetected and unreported, especially in areas where healthcare infrastructure is limited. Number 14. Is there a vaccine for astrovirus infection? There is currently no vaccine available for astrovirus infection. However, researchers are working on developing a vaccine. Clinical trials for a parenteral vaccine against astrovirus began in 2018 and are expected to be completed in 2023. Another clinical trial for a live attenuated vaccine is planned to begin in 2023. Additionally, several antiviral drugs are being investigated for their potential effectiveness against astrovirus infection. Number 13. Can I get infected with multiple strains of astrovirus? Yes, you can get infected with multiple strains of astrovirus. The 4 known genotypes of astrovirus, VA1, VA2, VA3, and VA4, can circulate simultaneously in a given population. Infection with one genotype does not confer immunity to other genotypes, which means that a person can be infected with different strains of astrovirus at different times. This can make it difficult to track the spread of the virus and may contribute to the high number of infections worldwide. Number 12. Are there any treatments available for astrovirus infection? Currently, there is no specific antiviral treatment available for astrovirus infection. Treatment options are mainly supportive care, such as intravenous fluids to prevent dehydration. In some cases, antiemetic drugs may be used to reduce vomiting. However, it is important to note that these are not directly targeting the virus and are not a substitute for preventive measures such as good hygiene practices and vaccination when available. As research progresses, more effective treatment strategies may become available. Number 11. Why should I be concerned about astrovirus infection? You should be concerned about astrovirus infection because it can cause serious illness, especially in young children and people with weakened immune systems. The virus is highly contagious and can spread easily in crowded conditions. Additionally, there is currently no vaccine or specific antiviral treatment available, although research is ongoing. By understanding the risks and taking preventive measures, you can help protect yourself and others from infection. Number 10. What can I do to protect myself from astrovirus infection? You can take several steps to protect yourself from infection, including washing your hands thoroughly and frequently with soap and water, avoiding close contact with sick individuals, covering your mouth and nose when you cough or sneeze, staying away from surfaces and objects that may be contaminated with the virus, and disinfecting frequently touched surfaces and objects regularly. If a vaccine or antiviral treatment becomes available, it is also important to get vaccinated and follow the recommended treatment regimen. Number 9. What should I do if I think I have been exposed to astrovirus? If you think you have been exposed to astrovirus, it is important to monitor for symptoms. If you develop symptoms, it is best to stay home and rest, drink plenty of fluids to prevent dehydration, and contact your healthcare provider. They may recommend testing or other treatment options based on your individual circumstances. Number 8. How long does it take for symptoms to appear after exposure to astrovirus? The incubation period for astrovirus infection is the time between exposure to the virus and the onset of symptoms. According to the limited data available, the estimated incubation period for astrovirus ranges from 1 to 14 days, with an average of 4 to 5 days. During this time, you may not show any signs or symptoms of infection, but you can still transmit the virus to others. Number 7. How long does astrovirus infection last? The duration of astrovirus infection can vary depending on several factors, including the severity of symptoms and the overall health of the individual. Generally, the acute phase of the illness lasts 1 to 2 weeks. However, some people may continue to experience gastrointestinal or respiratory symptoms for longer. Number 6. Can I transmit astrovirus to others? Yes, you can transmit astrovirus to others through various routes, including through direct contact with an infected person, through contact with contaminated surfaces or objects, and through the air via respiratory droplets. The virus can be shed in the stool and respiratory secretions of infected individuals. You can also transmit the virus through breast milk. It is important to take precautions to prevent the spread of infection, such as practicing good hand hygiene and avoiding close contact with vulnerable individuals. Number 5. Can I donate blood if I have recovered from astrovirus infection? The American Red Cross recommends that you wait 28 days after symptom onset before donating blood. This is to prevent any potential risk of transmitting the virus through blood transfusions. Number 4. What is the difference between astrovirus and SARS-CoV-2? While both astrovirus and SARS-CoV-2 are respiratory viruses that can cause similar symptoms, they are caused by different viruses and have distinct characteristics. Astrovirus is an RNA virus that typically causes mild to moderate respiratory illness, whereas SARS-CoV-2 is also an RNA virus that can cause a range of symptoms from mild to severe, including pneumonia and acute respiratory distress syndrome. The two viruses also have different modes of transmission, with astrovirus primarily spreading through fecal-oral routes and SARS-CoV-2 mainly through respiratory droplets. Additionally, there are differences in the incubation period, duration of illness, and available treatments and vaccines for each virus. Number 3. Is the current pandemic caused by astrovirus? No, the current pandemic is not caused by astrovirus. It is caused by a novel coronavirus, SARS-CoV-2, which was first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a pandemic on March 11, 2020. Number 2. What is the mortality rate of astrovirus infection? The mortality rate of astrovirus infection is low. Most people who get infected with the virus recover fully. However, in some cases, the virus can cause severe illness, especially in young children and people with weakened immune systems. The case fatality ratio for astrovirus infection is estimated to be less than 1%. Number 1. Should I wear a mask to protect myself from astrovirus infection? Wearing a mask can be a helpful preventive measure to reduce the risk of transmitting and contracting certain respiratory viruses, including astrovirus. Masks can help prevent the spread of respiratory droplets, which are produced when an infected person coughs, sneezes, or talks. These droplets can contain viruses and can be inhaled by others in close proximity. By wearing a mask, you can help protect yourself and others from airborne viruses. It is important to choose the right type of mask and wear it properly to ensure maximum protection. If you enjoyed this video, please don't forget to leave us a like and subscribe for more content. Thank you for watching.